So,
of course, welcome. Yes, until we come to the discussion portion of the presentation, when we're going to split up and have the opportunity for everyone to share. But if everyone could mute themselves in the meantime, that would be wonderful. Welcome, everyone. This is the Miami-Dade County New Mobility Initiative virtual community events. Thank you for being here. And on our screen right now, we have instructions on how to access live interpretation for Spanish and Creole, as well as how to turn on your closed captions and change the size of the closed captions if you wish. So if these are services that you are interested in accessing, please take a minute to follow the directions and set those up. And we'll also include them in the chat as well.
Buenas tardes o buenas noches. Mi nombre es María Angélica. Mis pronombres son ella y ellex. Voy a dar esta introducción en español, después en inglés y después mi colega la dará en criollo haitiano. Good afternoon. My name is María Angélica. My pronouns are she and they. And today I will give these instructions in Spanish, then in English, and then my colleague will provide them in Haitian Creole. Hoy estamos proveyendo interpretación simultánea para asegurarnos de que todos tengamos acceso a la importante conversación que va a suceder aquí hoy. Entonces, si ustedes desean escuchar la presentación en español y están conectándose desde su computador, les pedimos que por favor hagan clic en el globo abajo de su pantalla que dice interpretación, eligen el idioma que prefieran y eso es todo. Si están conectándose desde su teléfono, por favor toquen la pantalla de su teléfono, abajo a mano derecha toquen los 3 punticos que dice más, elijan interpretación de idiomas, ahí eligen el idioma que prefieren y arriba a mano derecha confirman poniendo terminado. Estamos poniendo las instrucciones también en el chat y también están en la pantalla. En unos momentos vamos a volverlas a compartir en el chat. Siéntanse libres de participar en el idioma que desean. Si quieren hablar en español, se les va a escuchar en inglés para las personas que quieren escuchar en inglés y en criollo haitiano para las personas que quieren escuchar en criollo haitiano. Y si tienen algún problema con la interpretación o preguntas, por favor déjenoslo saber en el chat y con mucho gusto les apoyaremos. Muchas gracias. Good afternoon, good evening. My name is María Angélica. My pronouns are she and they. And today we will be providing interpretation in Spanish, in Haitian Creole, and in English with MARB language services so that we can all participate in this important conversation that is happening today, regardless of the language that we speak. So this will be a multilingual space. And if you would like to listen in Spanish, in Haitian Creole, or in English, you can use the interpretation feature. If you're joining us from your computer, you can click at the bottom of your screen where it says interpretation and choose English if you would like to listen in English. The first part of the program will be in English, so you do not need to choose interpretation. However, during the breakout groups, if you are in a multilingual space, we will let you know and you can go ahead and activate interpretation. After the breakout groups, we may hear from folks in Spanish or in Haitian Creole. We will also remind you to please turn your interpretation on at that point. We are also dropping the instructions in the chat and we will do it when we're about to have multilingual participation. And if you have any questions about the interpretation or any issues, please let us know in the chat and we'll be happy to support you. Thank you very much. And now I pass the mic to Shirley.
Bienvenue tout le monde. Moi c'est Shirley. Jodi a nou gen espace qui multilangue et nous allons parler en anglais, en espagnol et créole haïtien. Mais que gens ou capable accéder interprétation et n'a mettre information ça dans chat là tout. Si vous utilisez ordinateur, ou après yon icône globe dans partie en bas écran là. Si vous sur une tablette ou soit téléphone, cliquez sur plus et puis vous après yon menu qui gagne là-dedans, yon option qui relève interprétation langue. Pour écouter interprétation, cliquez sur l'icône globe là ou soit sur interprétation langue. Après ça, choisissez channel langue. Soit utiliser un téléphone ou soit une tablette, cliquez sur fini. Si ou pa tande interprète la sou channel wa, mande aide dans chat la, ou soit leve men. Ou ka cliquer sous fermer audio original pour tande seulement interprète la. Soit parler, songe retenir une vitesse modérée et puis prendre un petit temps en temps, l'op changer langue. Tant pis, veille communication avec interprète là ou bien facilitateur yo, au cas nous besoin mando pour ralentir. Si ou pas qu'attendre interprète là, servi à chat là pour demander aide. Merci. Thank you, Maria.
Thank you. Okay, so while hopefully that is clear and everyone's getting set up, my name is Jen Cheek. I'm with Urban Health Partnerships. I'm Director of Healthy Streets and Public Spaces. And while folks are getting sort of their interpretation preferences settled, we're going to dive right in with a poll to get a sense of who's here and what communities you're representing and what's on your mind. And we're asking folks to use Slido. So it's a website, slido.com. And if you go to that website and enter the code #NewMobility, you will be able to answer this poll and we'll be able to see your answers come in on screen.
And while we're doing that, Jen, I wanted to point out to everyone who will be speaking today to please remember to speak at a moderate rate to facilitate interpretation, and also to look out for cues from the facilitators or interpreters in case we need you to slow down. Thank you.
Thank you. We have some responses coming in. Transit hubs, parks, farmers market, groceries, Brickell, to work in the movies, grocery store and green spaces. And for those who are still filtering in, we're answering a quick poll question while folks are getting their interpretation services identified. Corner store, nearby beach. This is where in your community would you go more often if it was easier to get there? Beach, Virginia Key, all the hot spots, Coral Gables. Great. All right, wonderful. We're going to be sprinkling in a couple other poll questions through Slido throughout the presentation, so feel free to keep that window open if you have it open. So welcome. This is the Miami-Dade County New Mobility Initiative virtual community event. Thank you for being here. Let me just make sure. So this project is from Miami-Dade County Department of Transportation and Public Works, and they are piloting new mobility solutions and focusing on gathering community input to inform how future development and introduction of these solutions can ultimately improve accessibility and mobility equity throughout the county. We have wonderful partners on this project. In addition to Miami-Dade County, the Knight Foundation, and I mentioned we're from UHP, Urban Health Partnerships, and also we have a couple people I think on the line here today from Ford Mobility, City One. So welcome everyone. The primary role of UHP and Ford in this initiative was to understand how the county's Department of Transportation and Public Works low-speed autonomous vehicle, scooter, and micro transit pilots could have an impact for communities across the county, while also meaningfully integrating community members into the planning, designing, and implementation of these innovative new mobility solutions. So we're not only testing the technology and the services, but we're also testing out new methods of integrating public engagement into the county's processes. UHP has implemented our community liaison framework for this project, and Ford has deployed their data science and community-centered research methods to ensure that diverse resident voices throughout the county are integrated. So the community engagement approach for this project was really broad. It blends, as I mentioned, data science and an ethnographic style research. Ford hosted, oh, yep.
The presentation is a little bit cut off on the bottom. I don't know if we can maybe refresh the page. Oh, there we go. Yes, thank you.
Let me see. Thank you. And that is Ren from UHP, who I'm sure you will hear more from. Okay, how's that? Good?
Yes, thanks.
Okay, great, thank you. So Ford hosted focus groups, one-on-one interviews, video diaries, and surveys to identify resident mobility needs and attitudes and sort of the unique barriers. In addition to Urban Health Partnership implementing our community liaison framework. These are some of our wonderful community liaisons. The community liaison framework is a framework of hired residents from communities across Miami-Dade County. They've been hired onto the project team to participate in the project design, the implementation, and also to lead engagement efforts in their own communities. So these community liaisons co-created and co-hosted a series of community engagement activities to connect residents to the new modes of mobility. And we're going to hear about some of those experiences and also have a couple of them who are here with us today share how it went and what they're hearing from their communities, and then provide an opportunity in some breakout rooms for us all to discuss our initial reactions to these pilots and how you can envision them sort of being incorporated into your own community. And the community liaisons were hired from specific communities. We worked as a team to identify diverse communities across the demographic spectrum to focus on throughout the outreach. The communities were identified based on key demographic factors, including racial demographics, median income and population density, average travel times, transit stop density, and vehicle ownership, as well as the county's—
Excuse me, this is the interpreter. Can you please slow down a little bit?
Yes.
Thank you so much.
Thank you. So I'm going to slow it down. I'm excited to get to the part where we're sharing from the community liaisons. So I apologize for moving quickly. But these are the 11 communities that were selected with the goal of providing not only a diverse view of the county, but also reaching people in areas that have been historically excluded from transportation planning initiatives in the past. So we wanted to make sure that these voices were really strongly represented in this process. So our outreach over the past year has been really focused in these communities, and this virtual event is designed to provide an opportunity for anyone, maybe within those communities or outside of those communities, to see what's been going on and provide feedback. So what are new mobility solutions? New mobility solutions are innovations. It's a broad term. Things such as semi-autonomous delivery robots, on-demand transit connectors, autonomous vehicle shuttles, and e-scooters. And for our project, we were focusing on two of those. The first of the pilot projects was this semi-autonomous delivery robot. The company who provided these robots is called KiwiBot, K-I-W-I, KiwiBot. And we had the opportunity to bring community liaisons to the Underline, if those of you who are familiar with the Underline in Brickell, bring them to Brickell, have everyone open the app. You need to order food from a website. We all ordered lunch, and the community liaisons were then able to experience having their lunch brought to them with this KiwiBot. They were able to see it in action on the sidewalks, in the crosswalks, on the road. They were able to interact with the app. So really have the whole experience before then taking this information back to their own community to figure out, talk to people, talk to their neighbors, talk to organizations within their community to figure out if this is something that would solve any problems within their community and how it might be received, and think about challenges or barriers that might come into play when implementing this type of service. So a little bit more about the actual KiwiBot. So these are questions that were asked by our community liaisons, so you can get a sense of how the service really works. The range on the KiwiBots is about 1 mile to 1.5 miles, but that can be flexible. The little robot can store about a cubic foot. The whole robot itself is about 1.5 feet by 1.5 feet by 1.2 feet in width. It runs on a replaceable battery that lasts 9 hours, and it uses a pre-mapped dynamic route to travel along sidewalks and crosswalks. So they also will stop if they run into a barrier or a person, they will stop before it hits that and navigate around that barrier. So we have some of our wonderful community liaisons on the line with us today who are going to share a little bit about their reaction to the KiwiBot. You can see them in here. We had 4 different experiences bringing community liaisons from across the county. And Raquel, if you're able to unmute yourself, I would love to invite you to tell us about your reactions and what, when you brought this information about the KiwiBots back to your community, a little bit about what you heard.
Hello, everyone. I'm Raquel. I'm a community liaison for Overtown. My pronouns are she, her. Well, when I tested the KiwiBot, I was wondering what would happen if it didn't work. And that's what ended up happening. There were some technical issues, but the people that were on site, they fixed it right away. And it seemed like it wouldn't be hard to get help if, anyone else had technical issues. I've been having one-on-one conversations with people in Overtown in my neighborhood about the KiwiBot. I heard from the community, some felt that it would be a great idea, especially for seniors and people without transportation. It could deliver their medicine for them. Some felt that it may be unsafe because it could get burglarized or stolen. And I was surprised about the number of people who were open in my neighborhood, and the number of people open to receiving the KiwiBot in our neighborhood. Some were worried that the KiwiBot would take away from jobs like the delivery service, Uber Eats and DoorDash. And that's pretty much the feedback that I received.
Thank you, Raquel. And we did, as we were hearing from the community liaisons about the feedback they were receiving, we've been collecting it and identifying themes that we can then report back to the county, or that the CLs can report back to the county. So as they're thinking through whether or not these are the types of services that they want to be supporting, if there are specific use cases that may be of interest, or particular populations who would benefit most from having something like a delivery robot accessible to them. So these are really helpful conversations to hear directly from Raquel and others about what might be possible or not possible within their neighborhoods. And we also, I believe, have Wendy with us today to share a little bit about her KiwiBot experience. Wendy, are you able to unmute yourself?
Hola, ¿me escuchan?
Yes.
Ok. Quiero compartir un momento de mi experiencia con el proyecto 1, que es el Kiwi Robot. Yo quedé impresionada personalmente cuando tuve que conocerlo a través de que yo necesitaba una comida de consumo. Nos enseñaron cómo hacer para bajar la aplicación en el teléfono y solicitar una comida rápida, mi preferida, patacones. Y yo quedé maravillada cómo ese robot pudo atravesar una calle, pudo acatar las normas de un semáforo, pudo subir la acera y pudo traerme la comida hasta donde yo estaba. Es una forma de tecnología avanzada, porque para que el robot entregue la comida, lo que tiene en su interior, yo tengo que permitirle a través de darle la señal a él a través de mi teléfono que yo soy la persona que necesita esa comida y confirmarla para que él pueda abrir la compuerta o la tapa y dejarme recibir mi comida. Me parece muy novedoso, seguro, un sistema muy original para aquellas personas que necesitamos una ayuda que nos traigan a nuestra casa, a nuestro trabajo, ya sea comida, insumos, medicamentos. Me parece muy novedoso, bueno y práctico sobre todo.
Thank you so much, Wendy. And I just want to highlight there that some of the themes that we heard across the board from all the CLs are listed here on this slide. Some of them have been mentioned by Raquel and Wendy. There's a lot of, there was thought that there was a potential benefit for people experiencing decreased mobility, especially older adults and those with disability. There was a lot of concern around safety and security of using the robots, particularly if they were delivering something sensitive like medication, which was brought up a lot as a potential use case. And that there was also a lot of discussion about whether the robots would be able to travel on certain sidewalks and whether they could be used to identify areas that needed improvements in sidewalks and crosswalks, as well as concern over, like Raquel mentioned, about losing jobs or that there might be a reduction of need in certain positions if they were taken by the delivery bots. And also whether the delivery bots could work in bad weather or areas without well-maintained infrastructure or in areas that didn't have great Wi-Fi or broadband infrastructure. So I'm going to move us into the next pilot experience, which was the Go Connect Transit Ride Connection Service.
Jen, the bottom of the presentation again looks a little, oh, never mind.
Back, great.
Thank you.
Thank you. So this is a photo of our wonderful CL Tara taking a ride on the Go Connect. To reserve a ride on the Go Connect, you have to download the Go Connect app. And this is a service that's currently being tested and provided by the Miami-Dade County. You can reserve a ride to a Miami-Dade transit station or any nearby destination if you're within the service zone. So the way it works, it's a little like Uber or Lyft. You'll be matched with other passengers heading in the same direction when you request your ride. And right now there is a maximum number of riders per vehicle because of limitations set in place because of COVID. So they are following all those safety measures. The Go Connect currently operates in these service areas. You can see Civic Center, Dadeland, West Kendall, and Cutler Bay. The ride is $225 in Civic Center, Dadeland, and West Kendall, and free currently in Cutler Bay. Again, these are this is a test period for this service, and you may have seen some pickup spots around town. You can see a sign there. There's a Go Connect pickup spot, but you can request it from wherever you are, and you may have to meet the ride at a location that's not quite exactly where you are, but a block or two away. But it will alert you in the app as to where your pickup and your drop-off locations will be. So you can see here some photos from some of the CLs using the service. And I believe we have Melanie on the line today, who's going to be able to tell us a little bit about her experience using Go Connect. Melanie, are you able to unmute yourself?
Yes, are you able to hear me?
Yes, hello.
Hi, my name is Melanie Rogers. I am the community liaison for Homestead. And when I went to test Go Connect, I actually had a very pleasant experience. I used the Go Connect service in the Cutler Bay area, so there was no charge for my ride. I downloaded the app for Go Connect, and we put in our location where we were located, and it gave us several areas for pickup. My pickup just so happened to be a walking distance away from where I was parked, and we put in where we were heading, and it arrived immediately. I want to say maybe about 5-6 minutes, the car was there. I was fortunate to where I didn't have to share a ride, but I know that, you know, sometimes you have to share a ride, but for our trip, we didn't have to share a ride. The pickup area was, you know, not a scary place or anything like that, well lit, things like that. And it was just a wonderful experience. The driver was personable, spoke, how are you doing? Are you familiar with the area? So it was very inviting. And he was actually someone from the community that we were in. So gave us a little information on our ride there. And what I heard about from my community was that they were so excited about this possibly coming down to us because Homestead has a lot of transportation issues. This would help with groceries. It would help them with going to the doctor, not bothering somebody else, and actually having the chance themselves to be able to go where they need to go. And the surprising thing that I heard from them was they didn't even know that this was available in the other areas because they frequent those areas as well. So it just was a pleasant experience for me all the way around.
Thanks so much, Melanie. We also have Carmen on the line today. Carmen, if you could introduce yourself and share a little bit about the Go Connect experience.
Sure, I'm Carmen Benitez. I'm from, I live close to Sweetwater. I took the ride with Tara. I had a good experience. The only thing is the guy was a little bit lost and Tara doesn't speak Spanish. He didn't speak any English. So I have to translate. That's the only thing. But I mean, I don't mind because I speak Spanish. But it was nice. The only thing, he was kind of nervous because it was the third day on his work, on his job. And he was kind of confused. But what I heard every time that I go like to the post office, to the police department, I met a lady in the police department where I usually go every Thursday, that she doesn't have a car. So she has to take the Uber or the other one. And she says it's kind of expensive. And it's going up because of the gas. It's getting to be too expensive. So, but she was asking me when is going to be the time that they're going to pick her up on her house and they're going to drop it on Miami-Dade, which is the Doral. I told her that I will find out for her because I'm not sure when it's going to happen. Because they want somebody to drop it on the job and take it back. Do you know when it's going to happen?
Sure. Well, that is something that we'll have to check in with Miami-Dade County about. They're going to be using the feedback provided through this process to determine, you know, if expansion is happening with Go Connect and how that might look and where it might go. So we will ask everyone to stay tuned, and we have some information at the end of the project if you want to stay in touch, so we can help follow up on some of these questions and provide more information as the pilots continue. So thank you, Carmen.
You're welcome. Customers are very excited, you know, because elderly people don't have a car because not only because the gas is too expensive, it's sometimes they don't have a car.
Mm-hmm. Thanks, Carmen.
You're welcome.
So these are some of the other themes that we heard from the full group of CLs when they were testing out the Go Connect experience. That there was a real need that could be filled by this service of those experiencing mobility challenges getting to nearby transit stops. There were some concern that the locations from the mobile app sometimes weren't easily accessible, or that you might have to cross a busy road, or there wasn't a crosswalk, or they felt there was some other way that the particular location that they were getting picked up or dropped off at wasn't incredibly safe. And we also had some concerns that drop-off locations felt the same way or were a little bit impractical or not quite as near to the destination as they were hoping. And there was some discussion that communication with customer service and the driver could be improved. So these were things that we were able to share immediately with Miami-Dade County and the provider of the Go Connect service once the CLs had their experience. And they have been able to make adjustments and changes to their plans and their operating procedures based on that feedback before the service expands to broader locations. Okay, so these are the two pilots that we are wanting to hear from you about today. Have you heard a little bit about how they went, what type of service they're providing? We'd like to do a quick poll again back at Slido. If you can navigate to that page, slido.com. If you can't get to Slido or you don't have access to that right now, you can provide your answer to the poll in the chat, and we'll have one of the UHP staff members import it into Slido for you. Thank you, Amy. So the question is, when you are moving around daily for work, school, errands, or other activities, what modes of transportation do you primarily use? And we have answers coming in here on Slido. It looks like car is predominant, with some scooters, bike or freebie. Tri-rail, a lot of walkers. More cars. Looks like car is predominant here. One more second. Okay. So now we're going to move into the breakout rooms to hear back from everyone about their thoughts, their initial reactions to these new mobility pilots. We're going to be assigning everyone to a breakout room. However, if you are using interpretation services for Spanish or Creole, we ask that you stay in this main room, and we'll need to know in the chat if that is your choice. So if you are using the Spanish or Creole interpretation services, if you could make note of that in the chat right now, we can make sure to assign you to this room so that those services can continue to be used. The other breakout rooms will all be in English. And I believe, Ren, correct me if I'm wrong, that everyone should get moved automatically.
Yes, I will. I am taking the time to take a look. Please do mention if you prefer the Spanish speaking or Creole one, and then I will make sure to not assign you into the English rooms, but I'm currently assigning people right now.
Okay. Thank you.
Take me a few moments.
Sure. We'll take a look at the breakout room discussion questions. Each breakout room will be discussing the same 3 questions. The first is, what words best describe your first reaction to seeing the pilots, the delivery robots, or Go Connect, or both, whichever you prefer to answer? What would be the top 3 benefits of having one of these pilots, pilot projects operating in your neighborhood? And number 3, what are your top 3 concerns of having one of these pilot projects operating in your neighborhood? So we're very interested in hearing your thoughts on those. We will have facilitators in each breakout room that will be taking notes on a Google Jamboard. And then we're gonna spend about a little less than 20 minutes on this discussion, and then come back here into the main room to hear from everyone. We're running up on time, so I want to quickly invite the facilitators of each breakout room to share some themes that you heard very quickly in your breakout room. And Ren, maybe we could start with you.
Sure. We had a lot of agreement that these were, innovative, exciting, but some of the things that I think were the first reactions were that when we were starting to discuss things like the benefits and the concerns, there was a clear benefit for connecting people to transit better through GoConnect, and especially in areas where it can be hard to get to a transit stop or there's difficulty because of various challenges with mobility. So improving access was a fantastic thing. And then some concerns about like, well, is that going to be easy for people? Is what's going to, help facilitate that can be worked in. And then as far as KiwiBot, there were concerns about the sidewalk and when there's already very narrow sidewalks around Miami-Dade County.
Great, thank you. And Amy?
Yeah, so some of the things that we heard were that the mobility options that were piloted would be great for various access, a great way to encourage use of transit that was not individuals using their own cars, and that, for instance, things like KiwiBot would benefit things like supporting families with small children or people with mobility issues that wouldn't necessarily be able to leave their homes.
Thank you. And Natalia?
All right, so in our discussion, a lot of the first reactions were that it would be really convenient for students and other people to be able to get groceries. This is for the KiwiBot and also for GoConnect. And also there are a lot of people who just do not drive. So it's a great idea for people to be able to just become more mobile. When we were discussing for the KiwiBot, in terms of the benefits, again, it came to grocery delivery, and it's going to be convenient for people with disabilities. And especially given the fact that we just had a pandemic, if we're ever to have another one, that it would really make it a lot easier for people to get their medications and get their food. And that it would help a lot of, especially the elderly, because that was a big one in our group, to be able to do the shopping without fear. So that was one of the big things. And I think that also would apply to both cases. In terms of the concerns, it was a matter of, I believe, cost or price increases that they were concerned about. We did have someone in our group facilitate the fact, in our group, let us know that that's not something that's going to happen because of the kind of program it is. So we were able to mitigate some of the cost concerns in terms of price increases. But there was also the big concern about it not being safe for food or medication potentially because of its size, and that it could easily be stolen based on the description that was given. And there was also a concern about maybe the wrong person being picked up. And so that could be a safety issue because of the fact that it's not a direct pickup necessarily, and that you're not necessarily seeing the picture and all the different things that people are used to now with the other modes of transportation. Also, there was a concern about the pickup and the walk, the distance that an elderly person might have to walk. And as a last concern, we had it about capacity, whether it's students or just people with disabilities, and who was going to get priority. So just how many of them will be available in a given area to support the population that exists in that area. So
Thank you, Natalia.
you're welcome.
We had very similar, similar discussions in our group, and I'll quickly show you what our Jamboard looked like. First reactions were similar to what you just mentioned, and that there might be a real opportunity for a solution for emergency management, particularly if bots could be used during hurricane situation. There was sort of overarching being half excited and half worried, thinking it could be a really fast action solution, but that there also provides a sort of disconnect within the community, meaning like the social disconnect of removing that human connection if the bot is delivering your goods rather than a human. And in terms of the benefits, a lot of agreement with the accessibility issue. If there's anything that can make these services and our streets more accessible and put pressure on making the improvements that streets would need in order to make a service like KiwiBot available, particularly like extra or dedicated lanes, things that would develop a complete street. So we had a couple fans of anything that would put pressure on creating the infrastructure that would be needed to offer these new mobility pilots. And then with the top 3 concerns, in addition to some of the things that have been mentioned, we had a concern about it potentially exacerbating the digital divide if we're providing services that require Wi-Fi and smartphones and that type of infrastructure, as well as wondering how if this effort is being put into focusing on this type of new mobility pilot, does that mean it's being taken away from some of the existing services and infrastructure? And we want to make sure we're leveraging the existing services in addition to exploring these new pilots. So those were some of the things from our breakout group. And I think Carlita and Louis was the last one.
We don't really have anything to report.
Okay, great. Thank you. Okay, so I think we can move it on. Just wanted to provide the information about the project. If you want to stay in the loop and follow up, you can visit our project page at urbanhp.org, where we have some summaries of what's been done, as well as an opportunity to share further insights. To access our community input survey, the link is here, and we also have it, we'll have it in the chat. And that survey takes about 15 to 20 minutes and allows you to provide much more detailed input on the services you're looking for in your own community. And we also encourage you to subscribe to project updates so we can keep you in the loop and make sure you know of other opportunities to participate, and that you can see the results and reports that will come from this project. So thank you for putting those into the chat. And we are going to stick around on this line for a little while to answer any questions that you might have, or if there are more discussion points that you would like to continue with us. We're here, we're happy to talk, and we really appreciate you taking the time this evening with us. So any questions? It looks like Louis has a raised hand.
Yes. Hi, everyone. My name is Louis, and I have a question about the last survey you put on the screen. The thing is, I see it's in English, and I know we got interpreter here for Creole and Spanish. Do you have a survey in Creole and Spanish also? The version for that? Also, we got an issue. Sorry, go ahead.
Oh, that's a great question. If you go to that link, it should have the option to choose Spanish or English. If you follow up with me, we can make sure that there's a Creole option available.
Louis, I think you're responding and you're muted.
When you break up the room earlier, we had an issue because it's only Spanish people and English was at the same room. And I didn't hear anything in Creole or but Spanish and English. I don't know if also an issue or nobody select any of Creole.
Sure. We'll have to look into that, Louis. I'm sorry that that happened. It might be that there wasn't anyone else using the Creole interpretation. So we appreciate you being there to serve that purpose for us. But we can follow up after and see what was going on.
Maybe we could ask folks to like what language they prefer or some when the registration. And then I was also thinking, is there other ways for us to come like participate, ask questions outside of this forum?
Currently, the website has an opportunity to provide feedback, and that can include questions. And also on all of our outreach materials, we do have our contact information. And so we welcome everyone to go ahead and email us if you have direct questions about the project. And we can leave our info in the chat as well. But it should be accessible from the project page. Mine in here right now. Any other questions?
Do we need to fill out the survey? The survey that you just said, do we need to fill it out, Jane?
The survey is the same survey that you've been sharing already, Carmen. So you do not need to complete that survey. It's the community survey. So anyone on the call who isn't part of the project team, please do feel free to complete that survey or share it with folks who you think might be interested.
Okay. Thank you.
Raquel. Is Raquel?
Yes, I'm here.
Okay, so you're gonna show me how to do the survey?
Yes. I'll get yes.
I don't think I can click on it from here, but
when I see her, I can do it. I can do it with her on my tablet or whatever. I'll do it with her.
Wonderful.
I think you've done it though. I'm not sure. I think she might have done it already, but I'll do it again.
Okay.
Thank you, Ingrid. Thank you, Raquel.
Okay. Ladies, I'll see you
You're
later.
welcome.
Okay, thanks for being here.
Okay, bye-bye.
Thank you.
All right, thank you, everyone. Feel free to follow up if you think of questions or other burning insight later. We'd love to hear it.
Thank you so much. Thank you to the interpreters.
Have a great evening.
Thank you, everybody. See you.
Good night.
Thank you.
Thank you all. Take care.
Thank you. Bye-bye.